Hi everybody, welcome back. My name's Josh Tarini and I'm an education specialist with Medtronic of Canada, and I'm really pleased to welcome you back to our education video series. Today we are going to talk about exercising at home. And living with diabetes certainly makes exercising more complex, but exercise is still very doable, has a lot of benefits, and can really be a lot of fun. So today we're going to look at a few elements of exercise, some benefits, some recommendations, and a few strategies. So let's get started. First, I'd like to remind you that anything we present today is not a medical recommendation. We'd encourage you to speak to your healthcare provider for any medical advice. Secondarily, we don't control the content of any external websites that we speak to during these presentations. So the topics I want to cover today are the benefits, barriers, and types of exercise. We're going to look at a few recommendations and strategies. We'll also talk about managing low and high blood sugars either during or after exercise, and that can be a real point of frustration for people with diabetes who like to exercise. And last but not least, we're going to look at CareLink software and how to help manage your exercise so you can look back afterwards and see what worked well, what might not have, and how you can improve the next time. Let's start with the benefits. So there are a lot of benefits to exercise. It may make you feel better, your energy may go up, self-esteem may rise, mental and physical capacity, and also you may require less insulin because your insulin sensitivity actually increases. In terms of other benefits, your stress will go down, blood pressure may go down, and also if you have any insulin resistance, it will also go down. So a lot of benefits to exercise. But what are some of the barriers? Exercising can be tough, and whether you normally go to the gym, walk around the block, take the dog out, or really prefer to sit on your couch, moving's not always easy. It requires some motivation and some get up and go. It can be related to the outside temperature. So right now, in the end of April, it's actually pretty cool out and it should be quite a bit warmer, and that's a pretty solid barrier. But sometimes we need to overcome these things and get out there dressed appropriately and do the very best we can. Living with diabetes, you might also be afraid of lows, either during or after exercise. So we will talk about a couple of things today to perhaps be able to prevent those lows or prevent your sugar from dipping that low at all. And also highs as well, because some activities can make your sugars go high during or after the exercise. And managing these variations in sugars, so the ups and the downs, can be pretty frustrating and make you feel poorly at times. So we'll talk about at the end during CareLink about how to keep a bit of a journal and look at your data so you can be comfortable with what you're doing, what you tried, and how it worked. And the other thing that can be a barrier is that you might have to test your blood sugar more frequently, which can be a great benefit and help you really achieve these exercise goals. But again, it's another step. So you have to find that individual balance. What works for you? What exercise types do you love to do, and how do they make you feel? And what are the best strategies to manage your sugars? So what are the types? We're really just going to talk about two types of physical activity. The first is aerobic, and the second is anaerobic. So aerobic activity is essentially working with the large muscle groups, repetitive movements over a period of time. Cycling, jogging, swimming. Your blood sugar most often will gradually drop during these periods. So most of these exercises tend to make that sugar go on the lower side, either during or after the activity. Doesn't mean you're going to have a low, it just means that your sugars will in general fall. Whereas anaerobic activity, which is a bit more high intensity exercise, quick exercise, short duration, spinning classes, weight training, resistant bands, these types of exercises often make your sugars rise during exercise. So it's important to understand the two types or categories of exercise and also how they might influence your sugars. So what does Diabetes Canada recommend in terms of how much activity or exercise someone with diabetes should do? Well, what they say for aerobic is at least 150 minutes a week of moderate to vigorous exercise. And from the anaerobic side, they recommend at least 2, but preferably 3 sessions per week. So definitely lots of good evidence to be active and feel well and experience all those benefits we talked about already. So what about some strategies? But first, before we talk about strategies, I want to talk about a couple of things that are really important to do up front before you exercise. The first is always know what your blood sugar is. It's very important to know where you're starting from. Starting from a blood sugar of 5 millimoles per liter is very different than starting from a blood sugar of 12.5 millimoles per liter. So you want to know where you are at the beginning of exercise, during exercise, and after exercise. The other important piece is active insulin. So do you have any bolus insulin on board at the time of exercise? If you do, you may want to keep that in mind as you go, because you will have that insulin continuing to work, continuing to bring down your sugars during that activity. So depending on how that goes, you might then change your meal timing and dose timing before you do activity the next time. So we're going to talk about 3 scenarios. The first is using a pump without CGM, a pump with CGM, and finally using the MiniMed 670G in auto mode. So if you're using a pump without CGM, it's generally recommended to do a temporary basal rate. And that's a situation where you can reduce your background or basal insulin for a period of time so that you're actually getting a little bit less insulin, which will be more appropriate for certain types of activity. Usually aerobic, but can be anaerobic as well, as sometimes your sugar may even fall, even though oftentimes it may go higher. And that's one of the tricky parts about exercise is that when you live with diabetes, you may do the same exercise on different occasions and notice slightly different variances or even directions in your sugar. So again, back to this, if you're a pump without CGM, it's recommended to set a temporary basal rate 60 to 90 minutes before you start your activity, run it right through your activity, and even for up to 60 to 90 minutes after. That's really a starting point. It can also be a starting point to run it at about 50% of your normal basal rate. But again, you'll want to do some experimentation and speak with your healthcare provider to see what would work best for you. Now, if you add a CGM to a pump, that does give you a little bit more information. You might need to test your blood sugar a little less during or after the exercise, but it doesn't preclude testing to some extent. So you always want to know where you're starting, where you are, and where you're going. We would recommend the same strategy as using pump alone. So that's a temporary basal rate started before you exercise, running all the way through and after exercise. And last but not least, I'd like to talk about the MiniMed 670G in auto mode. So remember that when you're in auto mode, your basal rates are actually auto-regulating every 5 minutes based on your sensor sugars. So it's a little different. Here you'd want to set a temporary target, which effectively moves your blood or your basal target up a little bit for a period of time so that you're getting a little bit less automated insulin during your activity. Again, the recommendation is generally 60 to 90 minutes for the temp target before your activity, running into, through, and even after your activity. So it works in a slightly similar way as the temp basal, but it's really important to understand if you're in auto mode what the temp target is, what works for you, and again, to talk to your healthcare provider if you require support during experimenting with this. And for any of these scenarios, it's really important to also think about whether you might need some quick-acting carbs before, during, or after the activity to make sure that your sugars don't dip low. So a couple more points before we finish up. What about experiencing a low and high related to exercise and physical activity? Well, if you do have a low, recommend it to treat the same way that you always have traditionally, 15 grams of rapid carbs, check again in 15 minutes, and if your sugars haven't come up, you'll want to repeat that treatment to make sure that your sugars are coming up and staying in that same level, safe level. And if you don't have a meal coming up soon, you will want to make sure that you have a snack as well, containing protein if possible, to tide you over until that next meal. If you're using the MiniMed 670G with CGM, either in manual mode with suspend before low or in auto mode, you might find that you need to treat your lows with a little less fast-acting carbohydrate because insulin may have been halted before your low. But again, that's a bit individual, and I'd encourage you to talk to your provider to make sure that you find out what works best for you. In terms of the highs, which you might have a high blood sugar after your exercise, important to stay hydrated and to wait before making a correction. Having a high sugar following exercise is a little different than having a high sugar following food, and you want to make sure that you proceed with caution because the benefits of exercise and the effects on your sugars can last up to 24 to 48 hours, and some suggest even longer. So if you do have a high after your exercise, you might want to wait a little bit to see if it levels off, and if you do decide to correct, you might want to correct a little bit more or a little bit less assertively than you normally would. Last but not least, I'd like to talk to you about CareLink. So if you haven't uploaded your pump into CareLink before, it's an awesome data management system where it takes all your glucose numbers, your insulin numbers, your carb numbers, puts it into graphs and charts so you can really understand how all the items have meshed together. Very important to understand how exercise has worked for you. So we'd recommend keeping a logbook of what exercise you've tried, if you ate any food around that time, what temporary basal rate or temp target you set, so you have a bit of a journal about what you tried, so that when you look at CareLink, you can see how it went. How well did that strategy work for you? Everybody's exercise, bodies, strategies are going to be a little different, and ultimately you'll want to find the one that works for you, keeps your sugars in a great range, and empowers you to get out and do the exercises and activities that you want to and that you love. So try a variety of things, different exercises, different strategy, find what works for you, keep moving the very best way you can, and especially during this situation where we find ourselves at home virtually all of the time, make sure that you're keeping moving, experiencing those benefits, and also doing the things that you can to keep your sugars as nicely controlled and in that nice tight range as you possibly can. So I really hope you found this session helpful today. I'd encourage you to watch some of our other videos if you haven't already, and get out there, get active, try these strategies, and I really hope that you find a few pearls of wisdom in here and that you have some great success being active. So thanks very much for watching and have a wonderful day.